All right. So thank you for joining. This is a quick little webinar on telehealth. With me is Dr. Zachary Winkelmann. Dr. Winkelmann is a clinical assistant professor and the clinical education coordinator for the post-professional advanced athletic training program at the University of South Carolina. He's originally from Houston, Texas, and completed his Bachelor of Science in Athletic Training at Texas Lutheran University. He then went on to attend Indiana State University for his master's in advanced athletic training, where he also served as the athletic trainer for the Division I Indiana State men's basketball team. And from there, he actually stayed at Indiana State to complete his PhD in curriculum and instruction with an emphasis in athletic training education. During that time, is when Dr. Winkelmann developed an interest in telemedicine and actually went on to obtain certification in telehealth, to be a telehealth facilitator. So thank you so much for hopping on and doing this. I greatly appreciate it.
Yeah, thanks for having me.
My pleasure. So can you explain, you mentioned that you became interested in telehealth and telemedicine during your PhD program. Can you go a little bit into what drew you to that and how you got started?
Sure. So it was actually right before I started my PhD that I got really interested in it. So at Indiana State, we were fortunate enough to have wonderful collaborating physicians, but unfortunately, they were an hour and a half away in Indianapolis. So we had an hour and a half drive there and an hour and a half drive back, which ended up being 92 miles to go maybe for a 2 to 5 minute appointment most of the time. It was like wound checks, pre-surgical checks, range of motion, after surgery checks. And it was very quick assessments. Now, our team doctors would come down to campus as well, but oftentimes the graduate assistant had to take we called it the tour de Indy, and would do a round trip around all the doctor's offices and go up there. And I obviously got frustrated by the drive and was like, there's got to be a better way to do this. And I ended up having 2 patients when I was working with the men's basketball team that one had to have surgery in St. Louis, which required us about a 2.5 hour drive multiple times for that appointment. And then I had an individual that post-surgical back in Terre Haute that had some trouble with this cryo cuff at home one night. And during those instances, we used FaceTime. I didn't know anything else at the time and started really connect with them and the doctors and trying to figure out what's the best way for us to do this without having to get in a car or commute, or if I needed to chat with you quickly, or if the patient needed to chat with me as the athletic trainer quickly. And then that's when I started to explore, like, maybe there's something else that's out there. And that's when I discovered telemedicine. Previously, I hadn't heard of it and never discussed it in athletic training, hadn't used it as a patient myself. And so really started to look at the literature and find out more about it and based off those instances.
Okay. So obviously in the era of COVID, telehealth is becoming much more prominent. What would you say if someone is trying to get started in telehealth would be a good method to go about starting utilizing it, both for safety of your patient as well as your own?
Yeah, that's a great question. I think from some of my research I did as we tried to implement it at Indiana State was really about the buy-in factors or the challenges that were experienced by the staff and the patients. And so one of the biggest things that we used was a theoretical model about planned behavior and technology acceptance. Now, if you're watching this, you probably have some interest in telemedicine or telehealth or technology in general. And that's the issue, is that you may be interested, but your counterparts, your supervisors, the other stakeholders may say, nah, we're not going to replace ourselves with robots. There's no point for that. We're going to lose our profession doing things like that. And that's the first step. And so while most people think it's, oh, buy this, enroll in this, make sure you have this, to me, it's about assessing your culture of your organization. Are we bought into trying to do things a little bit differently? It doesn't change who we are as an athletic trainer. It just provides our healthcare and delivery in a different mechanism. And so assessing your buy-in and the challenges of your organization, seeing if people are the norms of your organization, how the group mixes together and socializes and shares information about that. So I would say explore that. Look at how, if you have an EMR system, look how that went and how the people at your organization started to utilize the EMR. Did you have people that were pushback saying, I'm pen and paper only? Or did you have people that really bought in? Because those are your early adopters is what they're called. And those are the people that will probably be the ones that you want to get on your side to start taking off. Once you got that part down, then it comes to the fun part of finding the platforms and things like that. So finding out a platform that's HIPAA and high-tech compliant is key. So HIPAA is our general privacy and health insurance law, but we also have high-tech, which deals with electronic PHI. And so when we look at telemedicine, we need to make sure they're compliant with both. Then you got to look at things that are easily accessible from desktop and mobile computer or mobile phones. And so looking for apps or platforms that are accessible with a good Wi-Fi network, free or low cost to the individual, that are easily shareable or accessible for multiple people on different platforms like Mozilla or Safari. And so that's where it becomes fun to try to figure out which one works best for your organization.
Okay. So would you say someone is in a situation where they've got buy-in from their superiors, but finances are tight? We know that a lot of schools are cutting budgets and things like that, but they don't want to have their athletes be disconnected from them. Do you have a recommendation on how to find maybe some more budget-friendly options?
Yeah, so the disclaimer before I answer this question, I have been grant funded and I have other conflicts of interest with some organizations. So I just want to make sure that everyone knows that there are other platforms and other things out there before I make comments, but currently not funded by the organizations we're going to talk about.
Okay.
So there's a free app called Doxy.me. It's available through the iOS App Store and on Android. It works really well with Google Chrome, Google Chromebooks, things like that. And so Doxy.me is a free platform that if you're going to start out trying it out, that's a good one I would suggest to do. It also has a paid version that costs about $350 to $500 per year. That gives you a lot more features in terms of like screen sharing or three-way calling, document sharing. You can also bill for your services through that. So it has a lot more that's integrated in with the paid version, but they also have a free one that you can use a lot of the features, and it is accessible from desktop and on your smartphone. And so I think that that's a great one to start exploring and try to get used to. Now, during COVID, the Office of Civil Rights, which oversees HIPAA, has relaxed the rulings on what you can and can't do for telemedicine. So currently you can use things like Zoom that we're on, Skype, FaceTime, all of those are acceptable right now during COVID, but they aren't acceptable after or before COVID. And so I want to make that note there that using things like Zoom itself is not a safe platform to do telemedicine calls on. If you choose to do that, there's Zoom for Healthcare, which is a paid subscription outside of the general platform. There's Skype for Business. There's never use FaceTime. So FaceTime just doesn't have the encryption necessary for it to be safe. Now, if you have an EMR system called Healthy Roster, it has a virtual AT app built into it. And so it has a telemedicine feature that was built into the Healthy Roster app that I had used previously. I haven't used it in a couple of years, so if they may have removed it or changed it, but I did use it when they first rolled that out, and I thought it was pretty convenient. It was built right into the app, so it made it a little bit more secure. So it accessed your phone's FaceTime, so it seemed like it was working that way, but it was safe through the app itself.
Great. And I appreciate you also giving just your little disclaimer there. No,
yep.
Most people do.
I have to do that for some of the platforms and things in terms of just making sure people know I'm not trying to sell a product or anything to anybody, and just making sure people know that there's a lot of options out there, and that's the hard part. There's a ton of things out there. Like I have double robots that I use for research and for teaching, but double robots are super cool. So if you're like 10 steps ahead on telemedicine and you're trying to find the next thing, that's the next one. But they cost $3,500, and not every athletic trainer has that sitting around. And so I can understand and respect that starting with something like Doxy is a free and affordable option for athletic training, and then start to see how much your organization wants to buy in or invest in that.
Okay. So say you've gotten your approval, you figured out the program you want to use. How would you recommend going around documentation? Is it something where you would want to record the session and then try to upload it to your EMR? Would it just be a basic note? What changes do we have to make for documentation?
It's a great question. So first thing you'll need to do is do a general informed consent. So outside of your consent to treat form or whatever you have established for your athletic training facility and your practices, you'll need to get an additional one for telemedicine. That one will explain some of the risks and benefits, what the platform can and can't do, and what you may or may not be able to do for them. Now, in some states, this has to be written, a written consent form that people would sign and send back. Others you can do verbally at the beginning of your call. And so you'll need to document in your medical documentation that you either have obtained written consent or obtained verbal consent during your telemedicine call. Outside of that, I would not suggest actually recording the call, just because it's essentially like recording your physical exams in a clinic. So that contains a lot of information. Then it contains all the patient's health history, health information. And so then that goes into encryption, virtual privacy networks, how you're saving and storing it. And so it adds a lot of complications, if you will, in terms of the safety and precautions there. Now, I would suggest that in your EMR or your documentation when you're going, you can do things like screenshots. So say someone has a big arrhythmia or bruising, has range of motion and they're showing you it, take some screenshots of those and upload them to complement your EMR in your documentation, and just make sure that you're not showing their face, things like that. That way, when you save them and upload them, they're not really identifiable in terms of who they are, but you could add that and complement it and watch that over time in your documentation as well.
Gotcha. Would you say that you found with your use of telemedicine more of a limitation with dealing with patients, or even trying to coordinate with physicians, things like that?
I think actually it's been the opposite. So the hardest part was buy-in. So you got to make sure that parents, the patient, the coach, even the collaborating physician, and yourself all understand what we're trying to do, what we're trying to achieve. If you got a good team that does that, then I actually don't think it's too many limitations. Some of the limitations that did arise, or the challenges, I would say, I don't call them limitations, are Wi-Fi. Obviously, when technology is amazing, and technology always fails. And so making sure that you got a stable Wi-Fi connection, making sure a person's not in a car driving, and their safety of that individual while they're trying to do their telemedicine call. And so there's other things that become nuances to doing healthcare that you got to think about. Now, I think some limitations that obviously people think about is, how do I do my physical exam while I'm on a call? And I think there's so much more that you can do, and that we already do as athletic trainers, that don't require physical touch, that once we start to put that caveat in there, we start to limit ourselves. Like, well, I can't do my job because I can't touch someone. Well, you do your job a lot of times without touching someone. So what's different about this scenario or this situation? And so it's really about what I coined the term when I do these chats is the deconstructing what we've always done. So we have to take our traditional physical exam and really break it down to say, what was the most important parts of that exam that got you that information? Was it the range of motion? Was it the pain assessment? Was your history taking questions? Because typically the subjective history is the main part. The literature tells us that for pre-participation exams, that 75% of disqualifying factors are found just from history questions, not the physical exam. And so we're able to find out that a lot of what we do, we just need to ask people the right questions and listen and interpret and take that in. And that's why not everyone can do telemedicine. You got to be someone that's trained, have good clinical experience and good clinical reasoning to say, if I hear this, then it can't be this, but it could be this. You can't just do one test, say, all right, that's it, we're done. You really got to take all the factors in consideration and how they mix and match together to come up with your diagnosis or your rehab plan.
So you mentioned in order to do telemedicine, you want someone who has some appropriate training to do that. What would you consider to be that level of training to be able to do it?
Yeah, so this has been fun during COVID, Devin. So I think what's happened is that people are realizing that it's not as easy as just jumping on a Zoom call and seeing a patient. And yeah, you can chat with someone all day, but if you're actually going to do a physical exam or lead a rehab session, you need to have thought that out and have that background in training. So things like range of motion, palpation, special test, which ones can you do, which ones can't you do, which ones are advisable, how do you use what the patient has at their home to help facilitate a rehab session? I'm a big proponent of using a facilitator. So my telehealth training was from Jefferson University. It's accredited telehealth education program. And what my job that I got trained in that program was to be a telehealth facilitator. So me as the athletic trainer could be with the patient, facilitate the call with a team physician on the other call. So say you are a team physician, I'm the patient, and then I have person next to me that's actually helping to do what the physician's wanting. And that's a great way we think about how we could use telemedicine, is that it doesn't always have to be AT to the athlete. It could be team doctor to the patient with the AT facilitating the call. So we're doing the Lockman's test actually on the person with them next to us and just helping to interpret it for the team physician or dietitian, nutritionist, whoever's there that we're really trying to collaborate with. Outside of that, we got to think about how we're asking our questions. So if you think about your exam, oftentimes we are palpating, doing range of motion, assessing the person, and asking history questions. In telemedicine, you can't do that. You have to focus on one thing, answer, listen. You can't do all of it at once. And so it really makes your exam time a little bit more impactful, because I think you have to slow down and listen, interpret, and say, what's next, or why am I doing the things I'm doing? You can't just do the whole kitchen sink approach, which a lot of us take when we start doing our physical exams, is we just start doing everything, and we like, I'll do this test, I'll do this test, I'll do this test. And it's just not always feasible when you're on telemedicine.
Gotcha. Is there anything else that you would want to mention to someone who's first getting into telehealth? Especially, yes, we're moving hopefully in a positive direction through COVID, but we all know that things can change on complete turn of a dime. So
right. And I think that's what I want to encourage anybody listening or trying to explore telemedicine, is that what I got into it probably 5-6 years ago now, pre-COVID, and I literally have been told, like, this is never going to catch on. And then it took a global pandemic for people to realize, like, maybe this could work. And what I'm fearful of that is that athletic training is going to say, pandemic's over, we're done with telemedicine. Mm-hmm. And I want to encourage anybody that's listening to say, how do we incorporate this as a long-term solution to our healthcare? It doesn't have to be a replacement of everything. It could be a supplement to what we're traditionally doing. So things like winter break that we just got back from, that could have been 4 to 6 weeks that you have not seen a patient. And now they come back and they're like, oh, I had surgery. And you're like, what? It would have been great to check in with you or see your progress or check in with how things are going. Things like winter break, summer break, any of those options where we have a long period of time where we don't see a patient, or we start to reconsider our athletic training model. And I think that's where it's going to take time. But, you know, in physical therapy, and I'm not trying to replicate it, but in physical therapy, they only have a certain number of visits they come in and see your physical therapist. Now, what if we took that same model, but on the days they're not actually coming into the clinic, we did a telemedicine hour or telemedicine clinic, and they could just check in with us or do their rehab from home or their dorm, and they don't actually have to come into the clinic to do it. That could increase our adherence that we often patient blame for, saying like, well, they don't want to try, they're a high school kid, they're not really going to do their rehab. Well, maybe they're just not comfortable doing it in the clinic with everyone else around. Maybe they want to be at home doing it. So it's really breaking down what we've always done and saying, how could this complement what we are doing moving forward? So think of telemedicine as a long-term solution, not a fix to COVID. And I think we start to think about it differently, about accessing underserved populations in rural and remote areas. I was interviewing for a job in Montana, and Montana is a different state in terms of, like, it's massive, but it's very populated in specific areas. And so they have healthcare, which is great healthcare, but in very specific areas. And that means 2-3 hours outside of there, they may not have an athletic trainer or have access to a hospital nearby. And that same is true for Texas, Oklahoma, some of these large states, and even in South Carolina, where I'm at now, where we have an abundance of athletic trainers in Columbia, but you drive an hour or 2 hours away and people are like begging for healthcare to come and help them because there's no one nearby and it's very rural. So rethinking how telemedicine could be a whole new job sector for athletic training, that we have work-life balance issues. This could solve it. Like, this could be a new avenue for people that want to stay at home with their kids but still want to do patient care, or that have an elderly parent they need to take care of, but want to still connect with their patients. Like this could be a really cool avenue for us to explore as a whole profession moving forward too.
I think you make a great point of that because, for example, like I have an athlete who's about to have surgery 8 hours away, and
Yep.
I obviously can't take a week off to travel for one athlete for one surgery, but to be able to set up appointments to check in, how did it go, even to be able to be like, okay, like what does the surgeon need for on our end? What kind of protocols do we need? I feel too often people think we rely too much on an athlete to bring us back information, as opposed to what if we could set up an appointment like this to be able to discuss in more detail with a surgeon something that we couldn't expect a 18-year-old to relay to us.
Exactly. And I think that helps too, especially for in some of our research, we identified that with non-native English speakers too. So oftentimes they feel pressured to try to figure out what the answer is or say yes or no real quick. And telemedicine allows us to slow down a little bit and actually say like, are you comprehending what I'm saying, or is there a better way for me to reach you right now? And takes the ownership out of the physician or the athletic trainer and places it back into the patient's hand. Like I'm in control of the call. You
Mm-hmm.
can't control it. And I think that is so empowering to a patient. And that is what really, I think, is why telemedicine has taken off, especially for our 65 plus population. They thought it was going to take off for the millennials and Gen Z, and that's probably the least likely user of it right now because we've only been to the doctor. We don't know what it's like, but when you're 65 plus and can't drive anymore but need to see a doctor, you're going to figure out how you're going to get to see your doctor. And that same is true for your story, Devin, that you have a patient getting a surgery 8 hours away. That patient doesn't want to travel. That's a lot of cost, a lot of money. So why can't we use telemedicine when they're back with you as a qualified healthcare provider to connect with that surgeon, to do wound checks, to do check-ins on their progress and their changes over time and how that is going. And so could be a great way to really connect people interprofessionally and really help us to stake our claim in the community of healthcare about who we are and what we can do too.
Absolutely. I know we have a brand new health center on campus and they only can see so many people, but they have a telemedicine room that's set up for someone to be able to, they could sign in anytime because that's part of our contract is they can sign in at 2 a.m, log on to telehealth, and there's someone who's designated through our contract to be readily available. And I mean, I would be one of the first ones to admit before I got into AT, I would definitely be on, Google and WebMD at some ungodly hour trying to figure out why something hurts when it's not supposed to. And just the idea that like they can get qualified answers quickly, or
Right.
at least be, get something on the books. It's like, oh, this is bothering you. Why don't you set up an appointment to come in on Monday at this time, or whatever the case may be.
Yeah, and I think other things like emergency situations, we often don't think of immediate emergency care as something we can do on telemedicine, but it's actually something we probably do more often. Like I'm sure someone's had a family member that's called them and said, hey, I fell, can you help me? Or this doesn't look right, I think I got bit, can you check this out? And that's essentially what we're doing. But from the other angle too, I'm not promoting that we be the person doing mental health evaluations, but there are a lot of qualified mental health experts that do their appointments through telemedicine. And that provides that resource for those crises for individuals to say, I need help and I can't wait till the clinic opens at 8 a.m. And so
Exactly.
that helps people to connect them. So I think we need to be providing these resources, regardless if we're the ones doing it, to our patients to make sure they're aware of those things.
Absolutely. The mental health thing, I think, is hugely important, especially we've seen it with COVID. A
Yeah.
lot of mental health services are overwhelmed right now with the amount of people who need that support. So to be able to, outsource essentially,
Yeah.
even for example, like my clinic is a one-room clinic. It doesn't have a ton of privacy, but my office is blocked out. So to be able to put someone in who might be in a crisis situation, it's like, you're going to sit in my office, I can come check on you, but you don't have to sit with 5 other people potentially listening in
Right.
on a, really difficult conversation that you might be having.
Yeah, I totally agree.
So, Well, thank you so much for taking the time. I know you're probably just as crazy getting ready for the semester as everyone else. So thank you so much
Yeah.
for doing this.
Yeah, and I encourage everyone to check out some resources. The ATA, the American Telemedicine Association, has some really good resources that are out there. Also, the NATA also posted quite a few telemedicine resources during COVID. And if anybody has questions, feel free to reach out to me on Twitter. I'd be happy to chat and give you some resources or help your organization get started if y'all have any questions.
Awesome. Thank you so much.
You're welcome.